What we've done is we've given you an overview and give you a little bit of detail on Medicare Advantage and Medicare supplemental programs. Now we've got a few more presentations. Thank you very much, Gordy. For John Kaiser now is going to take you through, go to the next slide, there we go, about Medicare Part D, which are the drug plans. We've given you a little bit of information, but John will tell you a little bit more about how you can really customize your plan that you purchase based upon your actual drug usage, or prescription drug usage, please. So, John Kaiser.
Just when you thought you had enough of me. Part D is my favorite subject. It's a lot of detail, but knowledge is power as far as I'm concerned. As I already commented, once I get to my first slide, you guys are going to have to help me on this. Not everyone needs to have a standalone Part D plan, but everyone does need coverage. Okay? The Advantage plans include drug coverage, but those enrolling in Medicare plans will need a separate Part D plan. So we've already talked about that. And even though the Advantage plans include drugs, you should still input your drugs into the plan for drug pricing. Because what will happen is you could go pick an insurer based on the premium and the copays, and suddenly find out that based on your drugs, that's not the best plan for you. So if you're going to go with an Advantage plan, very important that you also price the drugs within that plan. Okay? The election period for signing up for Part D is October 15th to December 7th. That wouldn't affect you if you were just turning 65 or you're first enrolling, but that's for people who are changing, want to change their drug plans, which is coming up shortly. I mentioned before about if you don't enroll when you're first eligible, you face that penalty, 1% a month, 12% a year. One of the options you have with drugs is to go to Medicare.gov and plug in your drugs. And you'll find it quite easy to do. Again, you could use a consultant, but and they'll probably use the same website. But you go in and you could put in your drugs, and you'll get a list. I think in Michigan there's 30 insurers. They can be very significant between different insurers' plans because, and you should always price your spouse's plan separately because your spouse is probably on different drugs. You do not have to have the same insurer, and there's no household discount. It's always less to use the insurer's preferred pharmacy. The website will tell you if the pharmacy you've chosen is preferred or not. And also you could use their mail order. They all offer a mail order. And what I've done is on the website, I've gone in and done a step-by-step guide for using the website with screenshots and everything. I'm going to show you a couple examples of that. But if you go to our website, you'll see that. The one disadvantage is Medicare.gov changes their program every year, and right now I've got 2021 in there, and if you were going there to try to price 2022, you can't. It'll be updated either later this month or first part of October, definitely by the October start date. But, and then once they update, I can update. But in terms of learning how to use the tutorial, go ahead and use what I've got on the website. You'll learn from that. It's under the Medicare Social Security tab. It's called Tutorial for Medicare Part D. It'll have this presentation. And I actually have a lot more words than are on this slide. Okay? If you've already had Part D, what's neat now about it is it first lists your existing plan. It says, okay, here's what you're currently paying, and here's the next 29 plans. And you can instantly see whether or not you're paying. You could get a less expensive plan. You need to check it every year for two reasons. One, your drugs change, or can change. And as I'll talk to you later about the formulary, the insurer may drop a drug you're carrying, particularly if it's a brand drug and they drop it. Boy, you need to know that. Mail order versus retail pharmacy, it's your choice. More often now, retail pharmacy is just as inexpensive as mail order. It's whatever you consider the most convenient for you. Again, you always have the option to use the healthcare consultants. There's a couple of them are here today. They'll walk you through that. You're more than welcome to use them. But you're also more than welcome to go on the website and do your own. You can do your what ifs or what do you want to do. If you want to consider what would this drug cost me if my doctor put it on, you plug that in. It gives you. I find it fun to do. So, in general rules, their pricing first is the different pharmacies will charge insurers different prices for the exact same drugs that you have with you having the copay. So depending on the drugstore, the prices could be different. Standard pharmacy versus insurer's preferred pharmacy generally will make a difference. So you do want, again, like I mentioned, you do want to go to a preferred pharmacy for the particular insurer. The formulary, that's there's no true consistency there. They play games with that. It's a list of drugs they'll cover and in which tier they'll fall. They can also change during the year by notifying you. Quite often people miss the notice. And if they do notify you, there are some options where you can continue to get the drug, but only for a short period, or you can try to go to your doctor and change the drug, or come October, you go to a different insurer. Tiers for the purpose of pricing and copays, insurers generally use 5 different tiers: preferred generic, non-preferred generic, brand, non-preferred brand, and specialty. The higher the tier, the higher the cost to you. Generally, most plans, if you're in preferred generic, you can even get them free. There's no charge for the drug. The copays on the non-preferred aren't that high. What I've run into is one insurer will put a drug they'll list in their formula, they'll list the drug as preferred, another one will list it as non-preferred generic and charge you more. They play games with it. There's no rules on how they classify their drugs in their formulary, including whether they include them. Here's the confusing part. So, there's 4 stages to the drugs. There's a stage 1 where you pay a yearly deductible, and for 2022, it's now going to go up to $480. It was at $445 this year. Now, some plans, if your premium's higher, they don't charge you deductible, but you pay more on the premium. So you can get one with 0, but you're probably going to pay a higher premium. My point there is that make sure, and I probably make this again later, you don't want to just look at the premium, you don't want to just look at the deductible. You got to look at the premium, deductible, and the cost of the drugs. That's the number you want. Just because it's 0 premium doesn't mean it's going to be less money. You got to look at that total. You got to put your drugs in. And of course, the problem is you're putting your drugs in at a point in time. If your drugs change during the year, you're still locked into that particular insurer. Stage 2 is initial coverage. So you pay based on the copay tiers. And in this stage, until drugs, which are your insurer's cost and your costs, until they reach $4,430, you're still in stage 2. So you take the cost of the drug that the insurer's paying and the amount that you pay, and once that hits $4,430, you're in what they call stage 3 coverage gap, also known as donut hole. Now you're in this stage until your drug cost, personally out-of-pocket drug costs, hit $7,050. That's a huge number. People are finding today it's costing them more for drugs than it is for their health care. Once and I'll explain the $7,050 in a second on the next slide because that's a little confusing. Once you get past the $7,050, you're in what they call catastrophic coverage, and for the rest of the year, your drugs cost you 5%. But you've already paid out quite a bit of money. So let me give you an example, though, because there is some relief here. while you're in the donut hole, you're really gonna only pay 25% of the cost of a drug. So if you had a drug that was $1,000, the manufacturer is gonna give you a 70% discount, which takes it down by $700. The plan itself gives you a 5% discount, so your cost is 25%, which is in this example, $250. So the most you're gonna pay for that $1,000 drug is $250. It's not cheap, but that's the most you're gonna pay. And what counts towards that $7,050 is what you've already paid, your deductible, not your premium, but your deductible and your co-pays, and what you pay while you're in here. And once you hit $7,050, that's when you go to stage 4, catastrophic. And during the time that you're in the donut hole, your generic drugs cost you 25%, or in some cases, they're not even that expensive, but the rule is 25%. Once you get in stage 4, like I said, you'll pay 5% for the balance of the year. So this is the part that gets confusing for everybody. And again, this is all on the website. So you could enter the donut hole sooner depending on your drug plan and your number of brand drugs. I mean, I was on a chemo drug. I hit the donut hole and got out of it in January. I mean, it gets expensive. Most insurers charge a deductible $480 for 2022, but total cost, like I said, the premium, the deductible, copay should be your focus. If you choose a retail pharmacy for your drugs, you use your insurer's preferred pharmacy for the lowest cost. The website will tell you if you're using a preferred pharmacy or not, and I'll show you an example of that. With a new insurer, you only need new prescriptions for mail order. You'd have to send them in for mail order if you're using mail order. If you're using a pharmacy or your old pharmacy, if you're using the same pharmacy or a new one, you can transfer the prescriptions to the new pharmacy. And then once a year, if you've changed insurers, you should show the pharmacy your new insurance card. So they,
What slide?
I'm sorry, jeez, you guys gotta holler at me. No, I was on the right side.
One more.
Oh, I gotta go back. There we go. How did I get so far ahead? I apologize. I apologize a lot at home, too. Okay, so like I just said, if you have a new insurer, you've got to, unless you're not changing pharmacy, you're using mail order, you've got to provide those scripts. That's a little bit of a pain. A generic drug may be cheaper just buying it over the counter. You can always ask. There's like Good RX, there's discount plans. Generally, that's not going to be the case, but it never hurts to ask. I ran into that recently with a medication I needed. The gal said, "Hey, you can buy it cheaper."
Hey, John,
Yeah.
if I may, Mike, yeah, I have the mic, I have it on.
Yeah.
Yep.
Go ahead.
Well, here's what's interesting. All of these pharmacies work through benefit managers, and they have this rule that says the pharmacist can't voluntarily tell you if he could sell you the drug cheaper just for cash. But if you ask, he has to tell you. So in some cases, it pays, if it's an expensive drug, it pays just to say to the pharmacist, "Hey, is there a way you can sell me this drug for less money if I go around my insurance or use GoodRx or whatever?" And if there is, he'll tell you. And GoodRx can save you a fortune sometimes.
And when you need cash, it can be cash or credit card.
Yeah.
You're paying for it first.
Right.
Well, I don't know about the rule, but the pharmacy initiated the conversation with me, so maybe it works. Maybe it depends on the pharmacy. It did? The rule, Dale was saying the rule changed. Okay. Okay, you can confirm the cost with your chosen insurer by contacting and providing your drug list. I consider that a good idea. You want to be sure that Medicare.gov site has got it right, and there's a comfort, especially if you think, man, this is a good deal. Call the insurer that you're going to be going with and have them verify the amount, what you're going to pay. There's no reason, why not do that as an extra step? I just suggest that. And of course, you got to read them all your drugs. If you got a long list, and don't wait too long. These folks, including our consultants, they get very busy in October through December. And so don't wait if you're doing that. Again, if you guys are going in, your timing is different. I just mentioned our healthcare consultants can help you select the insurer and completing your enrollment. You have several payment options. You can pay with your credit card, which if you want the points, you can pay automatic withdrawal from your checking account, or they'll give you payment stubs and you mail payment once a month. So I'm suggesting you review your drug and your insurer choices every year. I do. I've switched many times. Even when you're online, if you're comfortable with it, you can click enroll and it just walks you right through it. They cancel your old one, add your new one. It's very important if your drug list changes because you just want to know if you're getting the best deal. If you have a second residence for part of the year, make sure you have a preferred pharmacy that accepts your insurer. That's a consideration. Your premium and coverage is based on your primary residence, but you also could use mail order. But if you're going to be in Florida 5 or 6 months, maybe you want to make sure where is that pharmacy? Is it convenient? But you're doing 90-day scripts, so for the most part. So next, I'm going to give you just a couple slides. I hope they aren't too hard to read.
John, let me just mention something real quick. It's important to check that, what John just said, check your list every year. Not only if your drugs change, but the formulary changes. The companies change the rules every single year. They get different deals, and sometimes they remove a drug. So you can get, if you don't check it in the fall, you can get a very unfortunate surprise in the first quarter when you order that drug again, and all of a sudden the price just goes up like crazy because that's no longer covered by that company.
Okay, thank you. When you first go into Medicare.gov, Medicare.com, it asks you if you want to enroll or if you're already enrolled. So you can log in if you're enrolled. And this actually, once this login gives you access to all your Medicare information. If you're going to go in and see some of your payments with Medicare, instead of waiting for a statement from you can go in and access all that stuff. So this is a good username, password for all that. If you haven't enrolled before, they're going to ask you if you want to create an account. So you go in and create an account, and you give them a username, password. This page indicates if you're already in Part D plan. This page will list your plan, and then ask you what you want to do. And down there in the bottom left, you choose update or print my drugs. So you go in there and you do that. You click on this. You want to do it. It'll bring up all the drugs. I'm not sure this is the right slide, but it'll bring up all the drugs you've taken during the year if you're already enrolled. And you can decide, oh, that was a one-time drug. I don't want it on my list. But at this point, you're going to go in there and purify or put your list of drugs in. They're going to ask you, they'll let you add them. Choose to add it. This page will appear, and you can start by typing the drug name. It'll guess the rest of it. You're going to be asked how many you take, how often you take it, and then do you want to add it. So you keep doing that with all your drugs. If it's the first time, you're going to have to do that for each drug. So now you're going to pick pharmacies. You can choose how far away you want to go. You put your zip code in here. I got Kroger in here. I like Kroger. It'll go find the nearest one, and hopefully it's the one you take. At this point, and then I should go back. What's new, and at least last year, is you can choose up to 5 pharmacies. So go ahead and put 5 in there. It can tell you later whether they're preferred or not. So I just pick the nearest ones, and you can choose one of those can be mail order. That way you can find out if it'd be cheaper to get mail order. So now, since we're doing a drug plan, you'll be asked to choose a type of coverage. In this case, you're looking for a Part D plan, so you choose Part D. This is a plan that I have or had. I think I still have it. Premium is $13.70 a month. This is this year's deductible, which is $435. And I did this on purpose. I threw a drug in there that was not in their formulary. And that's why you're seeing this $3,000. Don't worry about the numbers. I'm just trying to give you an example of what could happen if a drug's not in your formulary. So in this case, they're going to charge me $13.70 a month. I have a deductible, $435, and my cost is $3,292.68. And that's so then I go in and I say, well, let me compare that, and you can pick up the three. I want to compare the one I have with two others. In this case, I'm comparing WellCare to ARP to Blue Preferred, okay? And for purposes of the page, this is the top half of the page. But, and I hope you can read this. You'll see I pick CVS, Kroger, and Walgreens, and mail order. And you'll see in the first column under Kroger, they're preferred, and they're preferred at all three of these insurers. So, and I see that Walgreens is preferred on the number 2 and on the second and the third one. But my point I want to make here, and I hope you can read these numbers, you see that in the first column, they want $3,300 and some dollars. CVS wants $400, and the other insurer, which I think was Blue Preferred, which generally Blue Preferred is, you might find them to be more. But obviously, because the first one, WellCare, is not covering the drug I put in there, it's a huge amount. And of course, you wouldn't go with them, but it's a reason you got to put your drugs in, because you got to make sure your drugs are covered. In this example, I would probably go with the second one. They want, I can, for $479, I can go to Kroger and get it. So this is an example of me finding the least cost insurer. That's all I'm trying to say. And you can go in there and you can see how easy it is. You just go in there and you put in your drugs, put in your pharmacy, and you get all this information. And that's why I recommend you even do this on your own, or you can use the consultant. But they're going to do the same thing. So hopefully this gives you a clearer understanding of Part D. The more you play with it, look at it, the more you'll find that it's easy to use and understand. It's on the website. You can go in there and do what ifs. You can do yourself, you can do your wife, you can do your friends. I do friends all the time. The difference is, though, you need a login. If you don't have a login, every time you go in, you're going to have to put your drugs in. So you can go on the site and not enroll. But if you do, every time you go back, you're going to have to load all your drugs. And it's just easier to get a login. And again, I'll comment that you can use one of our consultants. So I'm open for questions. Yes. Yeah, wait for a microphone.
You showed the website where you could check like 2 or 3 different drug providers or companies,
Yeah.
insurers.
Uh-huh.
Is there a place you can put in your drug and check all the ones in your area?
Yeah, what you can do, when you go in and put your drugs in, after you put your drugs in and pick your pharmacy, it's going to list 30. I only chose 3 to look at. So you can make yourself, you go and look at all 30. They're going to be in descending order, so your least cost ones will be listed first. But yeah, you can see all 30. Yeah. And then you could go back and change and say, okay, what if I'm no longer on this drug? And you can play around with it. It's a very good website.
There's another interesting feature. If you set yourself up so you have a login to your Medicare site and you put all your drugs in, and then you look at, let's say, the top 3 or 4 plans, and you say, gee, these 2 plans look good. You can then go to the plan's website and do a login, and they'll ask for your permission to go to Medicare.gov and get your information. And if you give them permission, they will actually grab all those drugs that you put in Medicare.gov, pull them into their website. So
Okay.
then you can confirm what you're really gonna be paying right from the insurer's website.
Yeah, that's a good feature I didn't realize exists. I usually go into the insurer's website and type in my drugs. You're telling me they can capture them from Medicare.gov, that's great.
A question from the webinar. When is the Medicare.gov website available to shop plans for someone going on Medicare in July of 2022?
Well, the open enrollment period is coming up October 15th. It'll definitely be there. I checked it yesterday. I think it'll be there by the end of September or the last week of September. All you can do is keep looking, and you'll know right away. It'll tell you 2022 price tags. The other thing is, if you were in there looking at it next March, you're going to get a 9-month number, not a 12-month number, because you're 3 months into the year. So be careful when you use it. You'll have to annualize the number. Comparisons are good, but the pricing would be wrong if you go in there after December 31st. What's he supposed to do? Oh,
You said some of the coverage in regard to formulary and generic changes during the year.
Yeah.
Does that website update it,
The-
those changes, or do you have to wait?
once a
till
year,
April?
once a year, the insurer that you have will send you a booklet, and they will tell you what your new premium is if you stay with them. The problem is, they used to send you a thick booklet on every drug they coverage. Now you gotta go to their website. So, they're required, maybe I asked one of the consultants, they're required to notify you during the year. I don't know if they're required. David, one of the Davids, do you know if the insurer is required to notify you year to year? I'll give you a chance for the mic.
The price change?
Of a formulary change.
Formulary change. Yeah, they're gonna,
If there's formulary changes or price changes, either one, they're gonna send you out a notification every year. You'll get an amendment or a new book. If you're enrolled in a plan, every single year you'll get a new book coming from that carrier that has all the new costs for the drugs and stuff in it.
Okay.
They have to, because otherwise you would never know where things are covered.
Yeah. The other thing is, if
From
you,
personal experience, they can and do change formularies even mid-year. My wife had a script
yeah,
change and it went to a higher tier at a greater cost.
yeah, they can change on you during the year. Definitely notice you during the year. The other thing is, you go in and when you plug it in, you'll see that they don't cover it. It'll say on the site, not covered. But of course, you gotta go in to do that. But yeah, what you're worried about is if you don't do that, they take it out, you know. And David's saying that they have to notify you.
Yeah, I think they're supposed to, and they have done it in the past, but I have seen something saying check the website. This is the first time I've seen it that showed up like that, but hopefully they'll continue to do what David said and continue to send you the whole thing, but they seem to be cutting a corner, but that's just,
Yeah,
I'm not sure if that's a new change or we just picked up something
Yeah,
strange.
not to pick on Omaha, they're insured, but I had two friends on an AFib drug, they dropped it. And they had to go to a different, either change insurers or go to a different AFib drug. They dropped it. But I think they got notified and didn't notice it. But it is very important.